I could find out a little bread for plug.
Oh, the hang pack.
The little pads.
It has to
I
be
want
called.
it.
And
It's
so-
horrible.
All right, everybody ready?
Yes.
Okay. So part one, here we go. Mr. John Davis is a 52-year-old male. He presents to his primary care provider for a routine checkup. Reports occasional headaches and dizziness, but denies chest pain, shortness of breath, or palpitations. His medical history includes obesity, BMI of 32, sedentary lifestyle, and a strong family history of hypertension. Okay, so from that, are we worried about anything?
Hypertension.
We're worried about hypertension already, right?
There's a lot of.
We haven't even looked at vitals yet, we're just looking at the initial presentation.
And
So,
dehydration.
alright, so occasional headaches and dizziness, okay? That's not normal to have occasional headaches and dizziness, right?
Nope.
Okay. History of obesity, so BMI 32, sedentary lifestyle, and strong family history of hypertension. Genetics play a huge role in hypertension, okay? Let's look at our vitals. Blood pressure of 150 over 95.
Yummy.
Heart rate of 82, respiratory rate of 18, temp is 98.6, and here's our BMI again, okay? What stands out there?
Blood pressure.
Alright, what stage?
Stage 2.
Stage 2, okay.
Office grading.
But we also need a second because we need one that's baseline.
Good, so what is a possible diagnosis? What further assessment do we need? So we develop probably potential stage 2 hypertension, but we need what? Another set of vitals, okay? So we could potentially ask our patient, let's come in a couple of weeks, maybe next week or so, and we have to get 2 additional separate blood pressure values to definitively say he's got stage 2 hypertension, okay?
Would you want home blood pressure as well?
What do you think?
Yes.
Okay, so that's something we can educate our patient on, alright? Just because we don't necessarily have a diagnosis for hypertension, we can go ahead and start some adjustments, can we? And then come back in a little bit later and see if he truly has hypertension. But in the meantime, we also want to go ahead and encourage our patient to start taking daily blood pressures. Alright, if they don't have a blood pressure machine, we can write a prescription for it. Or the provider can write a prescription for it. Even after that, we can educate our patients to go to, well, it's not Winn-Dixie anymore, but sometimes like Kroger or Walmart, Publix, some of those have those little machines off to the side that you stick your arm in and take your blood pressure. As a kid, I thought those were the coolest thing in the world. I'd go and just stick my arm in it and didn't know why, but anyway. That and pulling out the coupons out the aisles.
I still do that too.
So, key here, it is possibility for hypertension, but we need to do some further assessment findings. We need a couple extra blood pressures to
So
figure
that
out
would
why.
mean we need another set of labs to do that.
Okay, so Mr. Davis returns after 1 week, and his BP readings on 2 additional visits, and some lab value or some blood pressures at home. So we got 148 over 92, and then we have another one of 152 over 94. Okay,
Diagnosed.
so now we can say he's got stage 2 hypertension, right? Got 2 separate readings of our blood pressure being elevated. Okay. All right, here's our lab values. So total cholesterol of 230. It says in parentheses high, but that's high, right? What do we want our total cholesterol below?
200.
Below 200, good. All right, LDL is 150, which is high as well. What do we want under?
100.
100, perfect. All right, HDL of 38. That's our happy cholesterol. So we want it above what? 60 if possible, okay? And then triglycerides, 210. We want that under what? 150, okay? Blood glucose, 112, so that's not bad. Creatinine's 1.1. And there we go, okay. So, after our diagnosis of stage 2 hypertension, what can we educate Mr. John on?
He needs to have a diet for cardiac health, probably low sodium, and also maybe something for diabetes because he's pre-diabetic.
Okay, so let's explore the, diet.
So low sodium, low
Low sodium,
sugar.
how much sodium?
Under 1,500.
Under 1,500, okay, so what can we teach our patient to eat?
Increase potassium.
Increase potassium, so yeah, we want our potassium 3,000 to 5,000, but give me some low salt foods.
Not canned goods.
Not canned goods, that's good, alright. So anything processed,
No
anything
pork.
fast food. Basically, if you think about the South and what we eat, there you go, that's gonna be high salt foods, okay? So we wanna go with like the chickens and the, fresh fishes, nuts, some nuts are pretty salty though, so, fresh fruits, fresh vegetables, okay? Nothing processed.
But if he's not a diabetic, you kinda don't wanna make that much food.
I mean, he's pre-diabetic, so,
And that could lead to diabetic.
good. Okay. And then we're also going to, tell him not to just add salt to his diet, right? So take away the salt shaker, alright, get some salt substitutes.
No extra salt.
There is,
McDonald's fries.
he could definitely use that potassium substitute of salt, cause he needs potassium,
There you go.
and he needs that.
Have you had?
Low saturated fats,
I can't.
sugar.
Low saturated fats, so no fried foods. He's not going to get chicken nuggets every day.
But when you kinda want him to increase it, cause I thought when potassium's low, sodium's high, and sodium's high, potassium's low.
Typically, yes, but we want the low sodium diet. We want those low saturated fats, cause he has abnormal cholesterol levels. He said nothing fast food, nothing processed. Something like that. Okay. Anything else that we can recommend for,
Moderate to light exercise. to be
moderate to light
included.
exercise? All right, give me an example.
Well, you could just go for a walk every day,
Okay.
or you go on a treadmill, maybe swimming. I feel like swimming's kind of not on your body.
What if you can't swim? I can't swim, so I wouldn't be good for me.
Don't do it.
I mean, I guess don't do it if you can.
If it's a pool 6'3" or less, I'm good.
Are you being serious?
Yeah, I'm serious.
There you go.
I was in
She
the
loves
water,
fishing,
but
but
can't
Calorie
You
strict
could do
diet.
yoga, there you go.
Yoga,
You might need the
okay,
yoga.
I was
well,
in
you
the
might need a
Navy
little
and I
more
can't
moderate
do it.
intensity than yoga.
Oh, wait, you need to go to water aerobic exercises in the shallow end.
So we need, all right, water aerobic
Pilates is
exercises,
more than
something
yoga.
with cardiovascular health. Kind of get that heartbeat pumping a little bit, okay?
Pilates.
Yes.
He lives a sedentary life, let's presume that maybe he has like a desk job, see, he can get like a walking treadmill.
There you go.
And get a
There's a
standing
lot of
desk.
us up there that have a walking treadmill.
There you go.
Not.
I bought one and it doesn't work.
Or maybe have a standing desk, okay? Maybe at lunch, take a walk around, take a loop, you know? There's ways to increase your exercise, okay? What if he goes to shop at Walmart, which is a terrible place to shop, but, don't park in the front, maybe park in the back of the parking lot, okay? That would be a hike, right?
Yeah, I'll say you just eat the edges.
Eat the edges, there you go,
Go
good.
to Aldi and only shop at Aldi.
Or go to Buc-ee's and park in the back of the parking lot and walk through Buc-ee's, okay? Don't buy anything at Buc-ee's, cause there's nothing good at Buc-ee's, but,
That's a lot.
that are
They're
healthy.
listed in.
There's not healthy options at Buc-ee's, we'll say that.
Get an app and monitor yourself.
Yep, get your app, get your steps in, get a Fitbit. So there's lots of ways, lots of things that we can educate our patients on, okay?
They have nuts and bananas.
Stress, what about stress?
Reducing it.
Reducing it, alright, so what are some coping mechanisms we can use?
Quit your job and don't go to
Breathing
nursing.
exercises.
Breathing exercises, good, so woosah.
Anti-anxiety medication.
Yes, we try not to go for that, but that's okay if we have to, okay?
Distancing yourself from any.
What about a warm bath? I don't take baths because they're gross, but, so what about?
Aromatherapy.
What about
literally. I don't take
Lay
that.
in your
warm baths or
I'll
aromatherapy?
take 3 baths a
Maybe
week.
some calming music before bed. You know, just
You're sitting in your own-
brainstorm these things for stress reduction, okay?
Music.
Calorie
What if
restrictions.
when taking a bath, you shower beforehand?
What about alcohol use? Should we educate our patient on alcohol use?
If he
Yes.
uses alcohol and if he smokes, he needs to stop smoking.
Okay, good. Alright. And monitor your blood pressure at home, right?
Correct.
Okay, after 3 months of lifestyle changes, Mr. Davis's BP remains elevated at 145/92. So now the doc is gonna decide to initiate some type of medication. So what kind of medications are we thinking that he may start on first? What's up?
Diazide.
ACE inhibitor,
ACE inhibitor, okay.
Diazide.
What if he's African American?
ARB.
Calcium channel blocker.
An ARB for an African American?
No.
No, calcium.
Okay, calcium channel blocker. What's an example of calcium channel blocker?
Amlodipine.
Amlodipine, all right, amlodipine.
I thought first line would be a diet.
Yep, so typically we're gonna start with HETZ, like thiazide diuretics, okay? And then we can further go in and do something like a calcium channel blocker or an ACE inhibitor. Okay?
Statin and GLP-1.
Not you, well, not for blood pressure, but yes. Okay. So, 6 weeks later, Mr. Davis returns. BP is now 140/88. So is our blood pressure medication working?
No.
No. Okay. But he reports us persistent dry cough.
Get off of it.
So that's one of our big key points with ACE inhibitors, correct?
Yes.
Okay. So I know we're not going to play doctor or prescribe medications, but we can think about it. Should we take should our patient stop his ARB or his ACE inhibitor?
Yeah, sure.
Yeah, probably so, okay? So maybe we can switch over to an ARB, maybe a valsartan. Maybe we need to do another diuretic or some sort, okay? All right, now we're 6 months later. We've changed up some of his medications as well. Mr. Davis's BP is at 130/82. Are we okay with that?
I mean, it's better.
I mean, it's better than that 150s, right? All right, so he's technically still in stage 1. But we're like him living in that stage 1 versus that stage 2 hypertension, okay? Of course, he's feeling well, all right? So no more dizziness, no more headaches, just that general fatigue, malaise. He's not just feeling terrible, okay? He's lost 10 pounds, all right, Mr. Davis. So he improved his diet and exercise 4 times a week. So, what are our take-home points? What are our key points to managing his hypertension long-term? What are we gonna educate the patient? Maintain it, right? So maintain what we have already established. So we want to encourage to continue his blood pressure medications, okay? Just because it's fixed now, does that mean that he can stop it? And a lot of patients will think so. Well, my blood pressure was fine when I checked it, so I didn't need it anymore. All right, that's just because my blood pressure was high. That's when I take my meds. The reason it's low is because they are taking that medication, correct?
Yes.
So we need to encourage our patients to not stop their blood pressure medication without talking to their doctor, okay?
Could he also get like a at-home blood pressure monitor, make sure it stays in line?
Yep, so we want to continue to encourage him to regularly monitor his blood pressure. So we want to, maybe once in the morning, once in the evening, check it at the same time, or right before his blood pressure medications due, check his blood pressure, okay? Or if he goes to Kroger once a week and they have a blood pressure machine there, get him to check it, okay? But we're also going to get him to come in to the healthcare provider and encourage him to get every so often exams, so every 6 months or so, okay? What else can we continue to encourage?
To limit his alcohol and smoking.
Okay. Yep, we can also encourage to continue those lifestyle modifications, okay? It's hard to stick to these routines. It's hard to change your diet and keep it the way it needs to. For him to kind of relapse almost and go back to those high salt foods, those saturated fat foods, okay? Maybe he's going through a dry spell or he gets depressed or something like that, got fired at work, and now he's not exercising like he should, okay? Still need to encourage some of that moderate intensity exercise, okay? And then we can also teach him about signs and symptoms of hypertensive crisis, because he's at more risk for that, right? Since he's got stage 2 hypertension, he can kind of go over the edge there. Maybe he misses a couple days of heart meds or something like that, and so he might have hypertensive crisis. And what is his plan from there, okay? So So we educate them to come in to the primary care physician or go to the ER. Come to us, let us help you, okay? If you start to feel that real crushing headache, that severe chest pain, that blurry vision, that dizziness, anything like that, okay?
Regular follow-up.
Yep, regular follow-ups, good. Questions about hypertension?
It's bad.
It's bad. Yep. Alright, let's move on to DVT. So, Mr. Robert Thomas is a 62-year-old male, presents to the emergency department with complaining of swelling, pain, and redness in his right leg for the past 3 days. Describes the pain as dull and aching, worsening when standing or walking, denies trauma, fever, or recent infections. Okay, right off the bat, I know it says DVT at the top, but what do we assume?
DVT.
DVT, we have that unilateral affected limb, so that right leg is the one that's affected. It has that pain, that redness, probably has some warmth to it as well. Past 3 days, hopefully he came in before then, but. Okay.
He didn't, so probably a farmer.
All right, medical history, hypertension, is that risk for DVT?
Yeah.
Yes. What about diabetes?
Absolutely.
Okay, obesity?
Yes.
Yeah, we have that atherosclerosis, that buildup more than likely. All right, recent hip replacement.
Yes.
Surgery.
Okay, so that's trauma to the endothelial tissue, you're right, okay? Smoker for 20 pack, a year history, right? Another risk factor, okay, let's move on. Here's our vital signs and our physical exam. Blood pressure 138/85, heart rate's 96, respiratory rate of 20, temp is 98.9, O2 sat's 98% on room air. Do we care about any of that?
Well, he's in stage 1 hypertension,
Yeah, I mean, he's a little hypertensive, we can't necessarily call it, classify it as stage 1 hypertension, unless it was in his history, which it is, so more than likely it's stage 1 hypertension. Maybe it's just a little elevated because he's in pain. He's hurting a little bit, okay?
Nothing on there is too
He's
low.
panic, anxiety, something like that. Okay. Right lower leg, swollen, +3, pitting edema, worn, and erythematous. So Hoffman sign, that's positive. So when you dorsiflex your foot, and you got pain in that calf, okay? And then you got normal calf refill, and pulses are present within that right foot, okay? We already talked about question 1 a little bit. Let's revisit it. What is the most likely diagnosis?
DVT.
DVT
Okay,
right now.
good. What risk factors does Mr. Thomas have?
All of his medical
Obesity,
history.
hypertension, diabetes.
Good. So basically, anything,
His whole self.
his whole history, okay? So there was 3 specific things, that we can kind of think about. So he has potential for Bocho's triad, right? Okay, so he has prolonged immobility, so potentially from that, recent hip surgery, more than likely he was laying around, okay? So that's that, venous stasis, okay? He's had also recent surgery, so he's had some type of, endothelial injury as well, okay? And then with his, smoking, and do we see diabetes? We did say
Yes.
diabetes. That can cause some hypercoagulability as well, right? So increased, factor for clotting. So you got venous stasis, hypercoagulability, and recent trauma. So you got your virtuous triad there. So real big, key sign for DVT, okay? Here's our workup. You don't have to necessarily, pay special attention, to the specifics. You know, your D-dimer is elevated, so we have a clot somewhere in the body, right? So that can kind of confirm, that our clot is there. Doppler ultrasound, so we're doing that, venous ultrasonograph, okay? It does confirm that DVT in the right popliteal vein, alright? So kind of the back of your knee, that vein right down there that runs back there in the calf, alright? So why is the Doppler ultrasound the best diagnostic test?
It's not invasive.
Does blood flow?
It's real, and you can see it in real time.
See it in real time, it measures our blood flow in and out, but it's also non-invasive, okay? I don't have to stick my patient, I don't have to put any big catheter in there. All I have to do is just a little, it's almost like the little ultrasound you get, when you ultrasound for pregnancy, okay? Roughly same idea on that, okay? Mr. Thomas has been admitted to the telemetry floor and now has been in the hospital for 3 days. Mr. Thompson presses the nurse assist button and is complaining of shortness of breath and chest pain. You enter the room and he is tachypnic, diaphoretic, and you notice his lips and fingers are cyanotic. Alright, so what are we thinking?
Respiratory.
Respiratory distress, why?
Because this clot has dislodged.
Dislodged,
Yeah, we're
okay?
getting pulmonary.
So we're suspecting what?
He's not getting good perfusion.
Pulmonary embolism, so he's not getting good perfusion, to some of those major arteries and within his lungs, some of those smaller ones. That clot can move throughout the lungs to a certain degree, but as it gets further and further distal out within your lungs, those arteries get narrower and narrower and narrower, so it gets to a point where it can't reach any further, and that's where it gets lodged into it, okay? So, Sam, what's our initial nursing intervention?
He needs some oxygen, I'm gonna call for a rapid, and, he needs to get some more heparin too, but, you know, I don't have a word for that possible.
Okay, so what kind of things are we going to anticipate? So we might potentially get some heparin on board, okay? He needs some oxygen therapy at the minimum, right? We can apply oxygen without an order, right? So how many liters of oxygen?
3.
can we put?
Up to 3.
Up to 2. Maybe we can fudge a little bit. Oh, that looks like 2.
With the bubble dusting.
Maybe that's 3, okay? So we can crank it up a little bit. It's an emergency situation, all right? Without an order, yes, 2, okay? What else are we gonna consider? What do you think the physician may order for us?
A PT and a PCT.
PT, PTT, maybe, see what kind of clot.
Arterial blood gas.
Okay, arterial blood gas, I like it.
Chest X-ray.
Chest X-ray, good. CT is a little bit better to diagnose PE, but we can order a chest X-ray as well, okay? And if he escalates further, what are we gonna anticipate? He's on a med surg floor right now.
He's gonna go to.
ICU, escalate care. That's a good answer for a lot of things, escalate care. So you shove it off and it's not your problem anymore, okay? That's what we do there.
More intense. So we can have more intense nursing.
Alright, so after 3 days of anticoagulation therapy, Mr. Thompson's symptoms improved. He's discharged on rivaroxaban, 20 milligrams daily for at least 3 months. What other lifestyle modifications should we give him? What should we teach him? No smoking, okay?
He should
What
have
else?
follow-up appointments and monitor for bleeding and use an electric razor.
Increases physical activity.
Alright, so Natalie said electric razor, increased physical activity. In the acute phase, are we gonna tell him to run around?
No. Maybe just like moving his legs, standing up, walking.
Okay, good. So as tolerated, alright?
Avoid
Are there
alcohol.
leg exercises you can do, like specific to clots?
You can just do some leg raises, just some range of motion exercise, anything to kind of get that blood flow going. What else?
Compression socks.
Compression socks, good, alright. Avoid long car rides if possible. If not, then compression socks. And then medication adherence as well. He needs to take that as directed, right? Okay. Right, last thing, and then we'll get out of here, okay? I know it's been a long time.
Yeah, you spoiled us with the last.
I know I did, and then I got in trouble, so we're gonna keep going.
Oh.
You really?
No, we gotta keep y'all here for a little while, so.
Oh, boy. What's my name to be today?
I don't know, but I swear my phone is nowhere near as fast as people's computers, so I always end up losing.
Is that?
That's where, really?
Just wondering.
Look, I need encouragement from my instructors, not
I'm not
Criticism.
the instructor for encouragement.
Guess what?
What, darling?
I learned how old I was today.
Oh my gosh, look how cute he is, he has little hearts.
You made it. Mine learned thirty.
I did. I didn't realize I was 33 turning 34.
Really?
I really did. I just knew I was born in 1991.
Really?
Yes.
Oh my. You're the same age girl.
I got pulled over this weekend and the police officer thought that I gave him a fake ID because he didn't believe I was 21.
Blah.
Who's CW? I like the hair on the CW.
You don't like my hard glasses?
Yeah, I love
I'm
hair.
afraid. Thank you, Tom Hardy, that was very encouraging and admirable. Yeah, he did my numbers last and he said, I'll order you her glasses, I do it.
Alright, everybody getting in that wants to play?
Hold on.
Who's
Wait,
good, son?
wait, don't ever.
Decided prepared.
Oh, I'm gonna do that.
You're not gonna
I think I'm scared.
Oh, I can change it. Oh, accessories. Ooh.
Yeah.
A pirate and a villain.
Oh.
Here we go.
You're a fox.
Oh no. Oh no, I slipped.
False. Okay.
I like got it like right in the middle of both. I used your trick. It's not, I'm so sad. Oh, I went right.
Okay. What's sildenafil? I know it's got ill in the end. That's Viagra, so.
It's also used for mega solid.
Natalie's in the lead, so.
I bet you swift.
False.
I mean, unless you have a urinary problem.
I got made fun of for saying this one.
Okay. Amlodipine. Famotidine is Pepsid. Okay. So it's similar, but not quite. Alright. Simvastatin is statin, omeprazole, that's another antacid. Okay.
This is making my heart rate go up. I'm too competitive.
This is a type of,
It's technically angiotensin II receptor.
Yeah, because you block Satan. Sorry, it ends in Martin.
that's
I like that, girl. Thank you. I came up
pretty
with
good, I
it.
never heard that before. Wow.
Oh, that's a very, very beautiful t-shirt.
Thank you, I took it myself.
I believed you for a second. There's like I'm locked in right now. I gotta go run when I get home. I got 2 minutes.
Job, spinach,
I gotta-
green leafy vegetables for vitamin K.
Yeah, run it. See the trail behind my car. My energy level is so high. I'm real hyped up on it. I'm just like shaky. That's a cute little picture too. It was like being in hospital. Which Natalie took first. I'm not taking it.
Alright, remember beta blockers, beta laugh out loud. I like that one, honestly, I'm gonna keep that.
You're welcome.
That is cute, Santa.
Thank you. I didn't get that from TikTok either. I pulled that by
Okay.
myself.
I feel like somebody's attacking me now.
Cause don't come to TikTok. TikTok is very,
I'm sure he's on.
Definitely on TikTok all the time, so.
You are?
No. I
For
don't even
real?
have it on my phone.
Really?
What? You don't know what you're missing.
You can't have it down. You can't have what? You can't download it.
Yeah, if you make your address to Canada, you can re-download
Yeah.
it.
And then you mentioned, don't even hit me, I would do that. She did not. Oh, he's meant to, I think, but reverse.
Did you just say?
But reverse?
Yes.
Okay, so vasopressors, you're gonna want constricts your
Just-
arteries,
I'm proud of
not
myself, I
eyelids.
have
Okay?
stayed in focus, I've been constant with myself.
Get it back, and then
Super
somebody
proud.
else.
Super proud. Oh, I don't know. Oh, yes. Oh, very good.
ARBs or R10s, and what'd you say about Satan?
Sorry.
Block Satan.
Block
It's like
Satan.
block angiotensin 2, and you take the R away, and that's Satan.
There you go.
That's how I remembered it from Colossians.
Who's blocked?
I wanna know who Blah is too.
I don't know, I'm scared.
I probably got this wrong.
Straight.
Okay, metformin, diabetes, your amlodipine or CC pond would be your calcium channel blocker.
Stay strong.
And then ibuprofen is your NSAIDs.
I am staying strong and fit.
Did you just, excuse you? Sorry, I couldn't see.
Okay,
I'm behind CW.
trying to reduce that blood clot or prevent it. Blah is on a hot streak.
Go shot.
No, I couldn't log in, so I'm gonna do it now.
I guess, I'm scared.
Okay.
I didn't see that as an option.
HCTZ.
That's probably I am not the last person.
I did.
And I'm not cheating this time.
And here's the blood.
Messed up.
Floppy girl?
Yep.
Lavix?
What?
Lavix?
I feel like I got that wrong.
Oh, man. A lot of mistakes, don't worry.
I know, you treat it with heparin, you manage it with.
So,
Okay.
initial treatment, you're gonna have
I
heparin.
messed up.
Usually warfarin or coumadin is gonna be more for your other clot. So like your mechanical valves or AFib, but can be
Why does
used
it
for.
say we all have bad days, try again? That's sad. It's better pep talk than
Blah.
blah.
Why is that guy sitting in my soul?
I feel like my cooking power is gonna
AI generated, so.
fascinate.
Yeah, we just had this question. It's a little different. Yeah, it's a little different, but.
No, it's different.
I really don't.
Dang, I forgot to change the picture on that. I was gonna go back and change the picture on that one, maybe that one.
That was cute.
Someone still got it wrong though, who got it wrong?
Ooh, broccoli really sounds good right now. Not that broccoli.
Type your answer.
Oh, Wait, it won't let us.
It won't let us-
You said look up.
Alright, so common name for anticoagulant.
Coumadin.
Coumadin, okay, good.
Wait, we all get it right?
I could not, I thought it was with a K, y'all. It's a C.
I'm scared.
Don't get that mistake.
That picture.
I don't know, is that sign?
Is he gnawing at his fingers?
It's a little,
I mean, maybe somebody put a,
he got hungry and was,
they did the alpha track through nails.
What else did he gnaw at his fingers?
he just got a little gnawing.
I might set my check on when I get home. I'm kinda a little bit. That was my good one. Okay,
I feel like I'm always behind her.
Why is my finger not clicking?
There's motion.
Oh, my cousin just.
No, I'm not stopping your foot.
What? It says the
Warfarin,
urine.
warfarin's intravenous.
No.
No, I thought we did heparin as a drip.
Isn't warfarin PO?
You can, but we also give some Q as well, so.
Well, but both of those are the
I feel like
correct
I should have been a
answers,
select all.
I can't
right?
alter.
No, somebody can.
It's all.
It's fine,
It's
keep
okay.
going.
It's fine. I can just, somebody believes in me.
Nelly, don't choke it in.
Stop, don't say that to me right now. Oops, I thought I smelled it.
Wow.
Alright,
Mr.
heparin
Brady, why
overdose,
did you say that? You know I don't like it.
protamine sulfate.
I'm sweating, okay?
Don't mess up. We've had this question before as well. Oh, look at there.
Oh, look at that.
Approximately.
Yeah,
So
'cause
hint, maybe a test question?
it's kinda important.
Why did I
Just saying.
I'm about to have a stroke right now.
why did I put eating?
It's not that deep, it is.
Oh, this is sad.
I hate always thinking that do bad.
Alright, last question.
Scorpion. If that was the answer, I would have clicked it.
Good job, Hannah.
Okay.
Haley.
Okay, can I say something?
She wasn't exploding.
Natalie. If you're not first, you're last. Shake it.
Who is blocked?
Can I say something?
What's up?
I appreciate 1, 2, and 3